Hi and welcome to episode 9 of Verbl Physio. I am Dr. Sudarshan and I would like to welcome you all. My four questions for today are ankylosing spondylitis patient wants to know what is the course of this disease and what role physiotherapy has to play. I have a question from someone who wants to know more about spinal adjustments and is it okay to have just a single session to cure the chronic issues. Then I have a question from a doctor herself who has undergone a disc surgery and she wants to know is it okay to do forward bending and other movements post 6 months of surgery. And my another question is from a cyclist who wants to know why does he get this soreness in his knee after a long ride and how can he avoid that. So before I start answering these questions, I would like to thank you all for watching our show on different available channels on social media, whether it is YouTube, whether it is Facebook or Instagram. We can see constantly there have been more followers, more viewers watching up this show. And in case you're watching this show for the first time and wondering what this is all about, well, I'm here to answer your questions. Yes, if you are a cyclist or a runner or someone who's into a fitness journey or struggling from a physiotherapy injury, I'm here to help you out by answering your doubts or questions. And you can put in your question in this particular link, which is drsudarshan.co/question, and I'll be more than happy to answer your questions in the upcoming episode. So let's start off our ninth episode with our first question. So my first question is from Dr. Nandana Tati, who wants to know, I have undergone a discectomy 5 years back and have been advised to avoid forward bending completely. Should I aim to improve forward bending or 90 degrees leg lifts lying down with my condition, or simply avoid or prevent future injuries? Thank you so much, Dr. Nandana, for putting in your question. And if you have undergone a discectomy, let me help you understand what exactly happens in a discectomy and what exactly is done in this whole surgery. Well, this is the human spine, and if we just take out two vertebrae and understand the anatomy and physiology between that, well, this is how the vertebra would look like. And as you can see, there is a content of the purple content is basically the overall disc. And if you see this jelly like substance, now this is the jelly like substance which actually pops out because of a tear, which we call a slip disc, and then this jelly like substance starts pressing onto your nerve. And when you do a surgery, basically what is done is that this jelly like substance is just cut off from your surgical procedure. Now if you would ask me that if you can do forward bending, or is it really advisable to do forward bending after 6 months of surgery, yes, it is absolutely okay, as if you are following a gradual fitness plan. Yes, in the first 6 weeks, normally all the surgeons will tell you to avoid forward bending, twisting and activities like this, because it can be a little harmful. But yes, post that you can certainly get into a regular exercise regime and start moving your spine, get into forward bending. Even leg lifts are good in order to improve your strength for lower abs. And yes, these exercises are definitely beneficial. In fact, the reason that you would have done the surgery is to get rid of the pain and certainly improve your mobility. So it's very important that you actually gain your mobility that you have lost post surgery. So there is no reason why you should stop, and yes, you should definitely continue with your movements. So I hope I have answered your question, Dr. Nandana. Thank you so much for putting in your question, and let's come up with the next question. So our next question is from Mr. Rajan, who's from Thane, and he wants to know, I'm suffering from ankylosing spondylitis, and what is the role of physiotherapy and medicine in this particular problem? Okay, so thank you so much, Mr. Rajan, for writing in. And ankylosing spondylitis, as such, doesn't have any specific known reason, but yes, it is seen with people who have a gene called HLA-B27 to be more affected or more commonly seen in these kind of people. It typically happens in a time of. It's more seen in males, and it happens in the middle age, somewhere between 35 to 45, and it typically actually affects more of your spine and your overall ribs, and then it also involves essentially large joints. The complaint that the patient would do is stiffness and reduced mobility, inability to move the spine. Simple activities like forward bending, twisting and rotations become very very difficult, and progressively this can also lead to a hunchback or severe postures in neck and lumbar spine. And so basically talking about the role of physiotherapy and medicine in this, well, the role of medicine is essentially painkillers and NSAIDs, which we call non-steroidal anti-inflammatory drugs, which basically helps to keep the inflammation under control. But physiotherapy definitely has a huge role to play, because if you are active throughout your life, if you can keep maintaining your range of motion, there are less chances that you get prone for more deformities, or probably get to a progressive stage where you develop a hunchback or a bad neck. Because we have seen a lot of ankylosing spondylitis patients where if they have been doing exercise on a regular basis, they keep these inflammations at a distance. So I think it's very important that you have a regular series of physiotherapy, and also get into more of non-weight bearing exercises, because weight bearing exercises can become a little bit difficult. Okay, so non-weight bearing exercises like exercising on a cycle, or probably even in a swimming pool, can really help a lot. Doing more exercises on the ball or on the mat can also help quite a bit. So just make sure that physiotherapy is a part of your therapy throughout this problem, and keep moving your joints, keep maintaining your range of motion. Stress is one factor which can definitely increase the amount of inflammation in your body, and you should try and avoid stress in this case. And this can definitely help in I wouldn't say healing, but trying to arrest the disease at certain points. So thank you so much, Rajan, for writing in, and I hope I have answered your question. Moving on to the next question. So the next question is from Paranjeet from Mumbai, who wants to know, I want to know more about spinal adjustments. Is it possible to get rid of chronic pain in just one sitting? Thank you so much, Paranjeet, for putting in your question. And doing this in one sitting for a chronic condition is definitely not possible. And let me help you understand that spinal adjustment is only one aspect of the whole therapy. Okay, as a physiotherapist, we do use spinal adjustments, but we also have a series of exercises that needs to be followed, or a series of overall protocol that has to be followed by the patient in order to get rid of the problem. Having said that, spinal adjustments do play a very very crucial role, because normally in terms of your injury, whether it is an acute injury or a chronic injury, your spine tends to get displaced to some extent. When it is a very minimal displacement or a movement, we call it subluxation. Okay, but when it becomes a major displacement, which is very very evident in x-rays, which we called it a anterosthesis or retrolisthesis. So where these are the different situations where you will see a forward displacement or a backward displacement of a vertebra. Well, spinal adjustments do help in acute conditions, specifically when it's more of a stiff neck and it just needs to be released in order to get aligned. This also induces your sympathetic system, which releases your activates your hormones, in fact, and that induces relaxation and a lot of pain relief. So these are the different ways where the spinal adjustments work. In case of chronic conditions, yes, repetitive sessions may be required after 1 week or 2 weeks, depending upon how the patient is recovering, how is he performing the exercises, and how the muscles are getting released. Once once the movement at the spine level is released, it is equally important that the muscles are stretched and the muscles are strengthened, because this is a contributing therapy. Only spinal adjustment is not going to work, because this is not just a magic pill that we are giving in one session. It takes time, because if it is a chronic condition, we need to respect that and we need to go easy by that. So I hope I have answered your question here, Paranjeet. And moving on, so my last question of the day is from a cyclist from Nasik. His name is Abdul, and he wants to know, I'm a cyclist and I feel this soreness and pain in my knees for about 2 to 3 days after a long ride. What could be the reason behind this pain, and can this be avoided? Hi Abdul, thank you so much for writing in. And yes, this pain could be essentially for 2-3 reasons. Firstly, if you are using higher gears and pedaling for a very long time, there are chances that you may get this kind of pain or soreness which can happen over a long ride. Secondly, you need to check the distance between your seat and your pedaling area, and ensure that there is not excessive knee bending which is happening, because knee bending should be minimal. And of course, being whenever you use a cycle, it's very very subjective, and you should always check the height which is very very comfortable for you. It should have a minimal range of motion for the knee. It cannot be too much of bending of the knee or too much of straightening of the knee, because that imparts a lot of pressure on the muscles, and because of which there can be soreness. One more reason why you could get this kind of soreness is if there are no stretches that are done after your cycling event. And normally this is what I have seen, that most of the cyclists only go through this event and they don't do any sort of pre or post stretches after the whole event is done. Now this could essentially lead to more soreness than it would have happened if you actually stretched. So I would strongly recommend you to do a proper stretching regime. You can actually check out our videos on YouTube where we have a stretching regime for knee, and we have specifically mentioned about every muscle, how it can be used, and you can actually check on that and see the list of exercises that can be done for cyclists. But yes, having this protocol is very very important. Having stretches for quadriceps, hamstrings, and even your ankle and your calf muscles. So it's very very important that a proper stretching regime is followed for all these muscles in order to ensure that you recover very well. Having an ice bath after your cycling session can make a lot of difference. It can help you recover faster, and your soreness can go down to a drastic level. So thank you so much Abdul for writing in, and I hope I have answered your question. Well, this was our 9th episode where we have answered questions from all our participants. Thank you so much for writing in, and for all those people who want me to answer your questions, please write in your questions on drsudarshan.co/question. You can put in your question in detail and I will be more than happy to answer. And before that, don't forget to log in or subscribe to our channel on YouTube, where you can get regular updates on this particular episodes that we'll be putting up every week. So make sure you keep watching and have a healthy life, and looking forward to see you in the next episode. This is Dr. Sudarshan Singh signing off.